We know something most folks don't know. All the sickness that black folks have, sugar diabetes, high blood pressure, all of that, nobody will die here today because there's an energy that supersedes all pain when you know your pain is being administered to.
Welcome to the WEAC Radio listening sessions. These are Dick Gregory's Raise the Ruckus, Not the Drug Prices listening sessions here at WEAC Radio. I am your host, Dr. Sanjeev Sriram, a.k.a. Dr. America, Health Justice Correspondent. And today we are at the Max Robinson Center of the Whitman-Walker Clinic Network here in Washington, D.C., in Anacostia on Martin Luther King Jr. Avenue here in Southeast, and we've got an excellent panel for today's listening session, and we're going to be talking about World AIDS Day and how the experience of HIV is affecting the nation's capital, and especially Anacostia. So, just to kind of get things started, why don't we hand the mic down the panel, and everybody can just sort of say their name and what their relationship is to this awesome clinic.
My name is Adisa Bakari. I am the operations manager here at Max Robinson Center and our youth office in Eastern Market. I've been here for 10 years, going on 11 in February.
My name is Faith Mitchell. I am the PrEP advocate here at Whitman-Walker, so I pretty much handle the day-to-day workings of our PrEP clinic, and I do some HIV testing and counseling. I've been here for 1 year, and I've seen a lot of great things.
My name is Dwayne Lawson-Brown, youth health educator for social mobilization over in our youth services location. So I plan a lot of events, do a lot of arts programming, all connected to HIV testing and counseling.
All right. Well, thank you all for joining us. I want to kind of start out with, as a pediatrician in Southeast, I am particularly worried about HIV and how it affects wards 7 and 8, and also our neighbor PG County in Maryland. And I am constantly educating, my young patients about how HIV is especially risky in this in their own community. And one of the programs that I would like to get more information out there about is about PrEP. And so, Faith, if you could just sort of walk us through what is PrEP, and maybe we can talk a little bit also about how much it costs. But let's just start with what is PrEP?
So PrEP is a daily pill that you take to prevent HIV. It can be over 92% effective if taken as recommended. And so pretty much it's a pill that's out here to help decrease new infection rates of HIV and be a tool to ending the epidemic that we see in DC and all around, the country. Here at Whitman-Walker, we have a lot of programming to help people start PrEP and stay on PrEP, as we are a health center. So we have providers here that can prescribe people PrEP. One thing that we do notice, and we see this with a lot of medications, is that PrEP can be fairly expensive if you do not have any insurance coverage. It can be up to around $2,000 or more a month for a person to get on this medication that's for prevention if you don't have any type of coverage. So that is something that's always a great concern, and that we hope to be a part in decreasing that cost eventually. But right now what we're doing is we're using the company Gilead, who is pretty much the provider for PrEP. We have people at Whitman-Walker who help patients get on their assistance programs that the program has. So one of the assistance programs they have is if you have no PrEP coverage at all, if your insurance won't cover PrEP for whatever reason, they can actually get you free PrEP. So you first have to try to get the process through going through your insurance, or apply for insurance first, which we can help you with as well. But if you don't have any coverage, we can sign you up for that program, and you most likely will get free PrEP through that. Also, one thing that people see a lot are copays. So when you go to the pharmacy, you may think, okay, my insurance is covering this medication, but you still have an additional cost due to whatever your insurance plan has for those. So with Gilead, they also offer up to $7,200 a year to cover copay costs. So if you have a copay and you're not able to afford it, then through this program that we will show you how to sign up for, you can get that assistance. So those are two great programs, and we really want everybody to be able to have access to the medication. So if you ever need that type of assistance, we definitely have enough professionals in our center that can definitely help you get to where you need to be at with that.
Okay. And how would a patient or a family know if they need to be on PrEP or not?
So in reality, PrEP is for anyone, and PrEP is for pretty much anyone who's having sex. So if you think that is something that would be beneficial for you personally, then you should always have that conversation. If you think that somebody in your family could benefit from this medication, then you should try to have that conversation with them, or maybe bring them to our health center and come with them and have that conversation with us. But there are definitely communities that have higher risk or vulnerability to the to HIV, and so we see in DC, last year the highest new infection rate was in Black men who have sex with men and Black heterosexual women. So when we talk about Ward 7 and 8, those are definitely two key populations that may want to have that conversation with us and see if it's right for them. But overall, people of color definitely should have this conversation and be thinking about PrEP, and like I said, anybody who's having sex.
So why don't we dig a little bit more into that risk, and Dwayne, maybe you can help us understand that, because I think that there's a lot of information out there about, HIV becoming a more manageable illness. You hear about celebrities and other people who, start treatment for HIV, and, they are probably not as familiar with some of the scary things that were going on in the 1980s and 90s with HIV and AIDS that I think may have been lost to memory, or may have just not been as recently experienced for people. So what is it that people need to know about HIV and AIDS in 2018?
So something that we've been seeing, I work within the youth department, and I've seen a lot of youth come in very informed. They know a lot about the virus, how it works, how it's spread, but there's still confusion about whether there's a cure, or who is living with HIV, how can I tell? So we're getting parts of the story out into the community, but other parts are still being missed. I'm worried about using fear as an influence. I'm more interested in giving people the full spectrum of information, giving them a full tool belt so that they can say, oh, PrEP is an option for me. Condoms are an option for me. The FC2 is an option for me. These are different things that we can, abstinence is still an option for me. Like whatever folks may choose, so that they can make the healthiest decisions that they can. We invite people to share their story, to share their truth, whether living with HIV or not, because we're all affected by HIV. And so we invite people to come in and speak to our youth, share their stories, and we share our own personal stories as well, so that folks realize this isn't just work, this is also life. And we're all in the process of living. And so that's one of the ways that we help raise awareness without influencing fear.
I'm really glad you brought that up, because I think that that's something that, my line of work in healthcare, I feel like our culture of physicians and nurses have still a lot of work to do, when it comes to letting go of previous ways of communicating about HIV from a fear-based model, and instead kind of adopting a more agency-based, life-based model that you're describing. So just to kind of keep rolling with that, what are some of the best experiences that you've had with youth in DC over the course of 2018 as we come up on World AIDS Day?
So earlier this year, we had a few youth who came in who didn't really know much about HIV or public health at all. Through our program, Lit DC, standing for Leaders in Training, those young folks sat through 3 months of training, and not just around public health, but also resume building, public speaking skills, things that really help you get ready for a career within public health. And now they're peer educators. Now they're walking around giving out information, giving out condoms, getting people to come in and get tested and learn their status. They've moved away from being so afraid of the virus that they were paralyzed and wouldn't come in and get tested and wouldn't talk to their friends, to now having a healthy understanding of the virus so that they can then talk to their friends, talk to their peers. And that's the whole goal. That's how we really create change.
All right, Dwayne, that's awesome. And so I know that there's a lot going on at Whitman-Walker. And as we're coming up on World AIDS Day, Mr. Bakari, if you can tell us a little bit about, like what we should be saving the date for, what we should be looking forward to and getting involved with.
Sure. So definitely this coming weekend, this Friday, I believe it's 11 until 4 at 845 Bladensburg Road. The CVS parking lot will be out testing. It's completely free. Everyone should come down and know your status. 4 o'clock until, till 8. We have a program called Golden Ticket. I'm going to let Dwayne speak a little bit about that because it's kind of run by our youth department.
So the Golden Ticket Party for Prevention is all about creating a culture where folks can have a good time, be more aware, and know what's going on, all while having access to HIV testing. So we rented out Tropicalia nightclub on the corner of 14th and U Street, and we're hosting a party for young folks 13 to 24. The entire thing has performances from a bunch of local artists who are on the verge of their next step. A bunch of free giveaways and raffle giveaways, but on top of that, you're getting HIV testing. You're learning information about PrEP. There's a lot of culture building in the space, and so that's from 4:30 until 11, and it will be a great time.
And then, interestingly enough, our Walk to End HIV, it's our annual event, biggest event we have every year, is actually going to be Saturday, December the 1st, down on Freedom Plaza. Everyone, please come out. Definitely be a part of that. It's an amazing event. I've been going for the last 10 years that I've been working here, and every year it's completely awesome. I bring my kids, bring my family, everybody. It's for everybody. So definitely come out and be a part of that. And if you can, donate to Whitman-Walker for the Walk to End HIV as well. We're reaching our goals. We're looking to shoot past those goals if we can as well. And then Saturday evening on DCTV, there'll be a program in reference to the 40 years of Whitman-Walker as well. So please check that out if you have DC cable, of course.
So definitely Saturday is a huge day. Lots going on in a lot of different places, and that's awesome. But for the day to day, I've been practicing in Southeast DC for about it's about 8 years now. So I'm pretty familiar with with this clinic and how awesome it is, because I'm able to send my pediatric patients as they get older and they graduate out of my practice, they're able to still get great health care here. But could you describe a little bit, for people who don't know too much about about Whitman-Walker?
Sure,
and what's going on just on a day-to-day here
Absolutely. So here at Max Robinson Center, we are a total care facility. We have a slogan, "We see you," and that includes everyone. We see everyone. When I first started working here, just a quick little story. When I first started working here, I spent a lot of time in my youth in this neighborhood. So people would come in the front door and they'd kind of be a little reticent to walk in because there was a stigma about what we actually were, who we were actually for, and that sort of thing. And it's gotten better in the community and gotten out that we see everyone. We do primary care, HIV care. We have behavioral health services, gynecology services, lab work, legal services. We have a public benefits department that will help you sign up for benefits. And we do an open enrollment every year to help people with Medicare get signed back up and get everything rolling for them as well. Now, when we talk about payments and fees and that sort of thing, we definitely, our public benefits department is awesome. They're connected with DC Health Link and all of that, getting people connected to services. We do everything we possibly can to have those fees, if there's any fees, as low as they possibly can be. We are just recently opening our pharmacy here for Whitman-Walker, for Max Robinson Center, I should say. We also have a pharmacy in our Northwest office. And we're really excited about that because that gives us an even bigger opportunity to help people who are having problems with paying for their medications, because the pharmacy is ours. We can work with them hand in hand to make sure that you can afford your medication, or maybe it's free for you and you don't even know that yet. So that's a big deal for us, big deal.
That's awesome. I'm really glad to hear about that part, because I think that that's actually been like a big challenge that I keep facing with, patients, especially as they get older and as they start to, kind of fall out of eligibility for child programs and they have to move into adult programs. Like it's a big deal to hear that there's that kind of support, on the other side of their teenage years. One of the things that you mentioned was about stigma. And I've always been an admirer of Whitman-Walker for it being being pretty courageous about just sort of confronting stigma head on. So if we could just spend a little bit of time talking about like where stigma has been and where it is now, and how does Whitman-Walker fit into confronting stigma and getting an upper hand on it.
I'll definitely say, specifically here in Ward 7 and Ward 8, a lot of that stigma is around sexuality. A lot of that stigma is around HIV in and of itself. So when I first started working here, and even growing up, a lot of the people in this neighborhood and surrounding areas had their own ideas about homosexuality, people who have AIDS or HIV, I should say. And like I said, they would come in the front door and you could look on their face and already tell they're really questioning whether they want to come in. And then I'd ask some of them sometimes, can we help you? And they'd be like, no, this is not what I'm looking for. And then, I would ask another question, and this is absolutely what they're looking for. Yeah. Sometimes people come in, really, and then sometimes people come in and they really need help with legal services. Yeah. But because of the stigma that they already had in their mind about what Whitman-Walker is and who we serve, they'd walk in, look, and walk right back out the door without even asking for any assistance, when we have everybody here is able to help you. Everybody here. Our legal department is amazing. So, the stigma in and of itself is, I would say it's a self-inflicted stigma, and that, people have ideas about, if I go there, am I going to get this or that, or I don't want to sit next to this person or that person. And honestly, that should be the farthest thing that you're thinking about. If you need assistance, come in. We can help you.
And, Faith, just to kind of bring you back in, because, I know Adisi's been here, you were saying 10 plus years, and I know, and you were saying that you've been here a year and some change. And so, kind of sticking with that same question about stigma, like, from what you've seen in your previous experience before joining Whitman-Walker and now, how do you feel like the clinic makes an impact on helping patients and families get over the stigma around HIV and sexuality?
So prior to coming here, I did work at Howard University as a sexual health educator. And so I saw similar things as far as stigma against homosexuality, stigma with just having HIV in general, and stigma with the type of sex that you're choosing to engage in, just because you don't want to talk to your friends about it maybe, or you don't want to even talk to your primary care physician about what you're actually doing and what's actually going on. I think what I really like about Whitman-Walker is not only do we have our providers who are striving to be culturally competent every day and really providing a comfortable environment for everybody to be open. We also have our community health team that goes out into the community and is trying to dispel all these myths and really eliminate the stigma that there is. And so we do have HIV testing pretty much every day at both of our sites. And so when you come in for a counseling session, a lot of people are thinking it's going to be maybe an in and out, you get your test and you leave. But we really do have a conversation with you about what you're actually doing, what's going on with you, how is your day? You know, why did you really come in here today? Because some people do just come for the routine checkup, but some people have a lot of questions, a lot of things that they really need to talk about with us, which is surprising. You know, we really have some good discussions in the testing counseling room. So I think that what we're able to do at this health center is provide an open and safe environment. Like Adisa said, we see you. And so we're going to meet you where you are and help you get to the best health outcome that you can possibly have.
Indeed. Over the years, I've watched youth go from really a big stigma around folks who are homosexual or queer to now having pretty much open minds around that. What we're seeing now is stigma around gender. And so a lot of, not even really full stigma, but just a lot of confusion. Folks are learning more and trying to understand more about trans lives and how things that they may have done in the past affect folks who are trans. And so there's a lot of confusion, and with confusion sometimes comes ignorance and pain. And so that's really where we're working. We're working to try to inform folks so that they can lessen the load for somebody else.
Yeah, I want to ask some follow-up questions about that. Again, kind of like, I mean, what have you seen and experienced? Because I think that has actually been a major challenge for me as a physician to help families get a better understanding of gender for, you know, their loved one who might be trans. And I think that it's requiring an unlearning of old ways of looking at gender and a reading of some things, and then also to understand how did that old understanding contribute to pain that, you know, regardless of intent, is something that their loved one has experienced. So if you can kind of describe like how you guide people through that, that would be great.
So there are two sides to this coin. Within our youth center, we start with language. Everything about the way that we reference folks had to change. So going away from binary language and working toward more inclusive, gender neutral language, just in referring to anyone. The other side is Whitman-Walker Health within the Youth Services Department has a family navigation team. And so that team works with families, whether they're dealing with HIV, whether they're dealing with gender neutrality and understanding, and their friends and family coming out. They help in that entire process. So they'll guide people through the medical process. They'll guide people through counseling and mental health services and behavioral health services. They basically handhold the entire process so that folks can have the easiest transition into their full life.
That's awesome. I know that we covered a lot about what's going on this Saturday, but are there other programs that we should be keeping an eye out for in 2019? You mentioned the pharmacy. Are there other things that we should be keeping on our calendar and keeping an eye out for as December and the new year roll in?
Yeah, absolutely. Whitman-Walker, we're doing stuff all year, every year. We have a lot of programs that we may just spark from a conversation. One program that we have here at Max Robinson Center every summer is our East of the River East of the River Festival. It has grown. We've gone for now, this is our fourth year, I believe. First year, the weather tried to stop us, but it was still a successful event. And we've grown every year. The last 2 years, we've had it right here in our parking lot at Max Robinson Center. And what we noticed last year is we've definitely grown to the point where we're probably going to need to go ahead and go back to the block party mode as well. So we'll block the street and have it out in the street. And it's an event people can come to. You can get tested for free. We have a lot of giveaways. We give away about 300 book bags with school supplies for the kids going back into school. And we have a lot of different other companies that come as vendors and give away their things as well. Youth Services actually has events every day of the week. So let Dwayne speak a little bit about what they're doing over there. But yeah, it's awesome.
So in our drop-in center, every day there's something different happening. Anything from open mics to our Sex, Milk, and Cookies open conversations around sexuality and health. Something that I'm personally a big fan of is our Floetic Friday series. On the second Friday of each month, we host an open mic on our 14th Street location. And then on the last Friday of each month, we host one at our Eastern Market location. And that's a space for youth to speak freely and share their truth. In every event that we have, we also offer HIV testing, pregnancy testing, and STI testing. A big event that I'm personally a big fan of too is the Color Me Woman open art exhibit. And so it's all women artists, all women voices, and information about PrEP and from our PrEP navigation team. And it's an amazing example of listening to the community and having the community lead the event. And so that's one of my personal favorites.
And just quickly, and then I want people, when we talk about the youth office, I want people to understand that is an excellent opportunity for your kids. If they're getting out of school 2-3 o'clock, you can drop into our youth service office and they'll have a great time. They'll love it there. They'll learn. They'll get community service hours, all of that. So definitely something, parents, please definitely look into that for your kids. If there's any kids watching, look into it for yourself. It's a great opportunity for you.
I was going to say, just last thing, our community health team, we do a lot of outreach. So we don't only host our events or go to Whitman-Walker events. We can go to your event. So if anyone in the city needs someone to come and do HIV testing at their event or just talk about anything related to sexual health education, we can come and we'll do that for you and be a part of any conversation you want us to have.
And again, with our mobile unit, I'm a big proponent of us doing this, and we'll come out, like Faith said, we'll come out to your events. So look out for our testing van. It might be in front of a club, might be at a subway station, could be anywhere in the city. So definitely, if you see that van, go get tested, know your status. It's extremely important for you.
All right, and I think that's actually a huge message for World AIDS Days is to know your status and to, begin the conversation about your status if you haven't been part of that conversation before. You've been listening to the WEAC Radio listening sessions. These are Dick Gregory's Raise the Ruckus, Not the Drug Prices listening sessions here on WEAC Radio. I am your host, Dr. Sanjeev Sriram. I'm the health justice correspondent for the network. Thanks a lot for joining us. Until next time, take care.
You see, remember, we know something most folks don't know. All the sickness that black folks have, sugar diabetes, high blood pressure, all of that, nobody will die here today because there's an energy that supersedes all pain when you know your pain is being administered to.